That was a really long first part to chapter 10 within the upper extremity of the shoulder. I promise you that these next two parts on the elbow and forearm and the wrist, hand, and fingers are going to be shorter. Can't guarantee you how much shorter, but they're definitely going to be shorter than that first part. So let's turn our attention to the elbow and forearm. Remember, as we're working down, the elbow consists of the humerus, the radius, and ulna bones, and really this area is considered the area between the elbow and the wrist where the radius and ulna lie. And these are two primary bones as well as the humerus that make up the elbow joint. One of the first injuries that we will look at are fractures. Fractures of the radius and ulna can occur separately, or both bones can be fractured simultaneously. And we need to make sure if we do see a fracture or identify a fracture that the athlete may be experiencing this thing called a Volkmann's contracture. Volkmann's contracture can result from a traumatic injury to the upper extremity, particularly the elbow, humerus, or forearm, which causes significant swelling. And with this swelling or edema, it presses on the blood vessels. And if the blood vessels then, because they're being pressed on with all this swelling and edema, they cannot deliver oxygenated blood to the distal upper extremity or down to the wrist and hand area. And if we don't get this blood to the area, then we can't contract the muscle through the full range of motion. And this damage from the lack of oxygenated blood to the area could be permanent. This insufficient blood flow and oxygen causes the hand to take on a claw-like appearance, as you can see in that picture, due to the muscle contracture from lack of oxygen to the tissues. The muscles in the forearm and hand are contracted in a flexed position, and the athlete cannot passively extend the fingers. And this is what we would call a medical emergency, and we need to call EMS as soon as possible, because as minutes go on without this oxygenated blood to the area, tissues will start to die, and this position may become permanent for that individual. When we look at mechanism of injury for fractures, again, they typically occur from fall and outstretched arm. We have a lot of injuries to the upper extremity from that mechanism, or it can be caused by a direct blow to the area. An athlete can also be in a weight-bearing position where the hand is fixed on an immovable surface, and the athlete twists as his body remains in that fixed position. Look at signs and symptoms. Athlete may have severe pain, point tenderness, loss of function and sensation to the area. They may also have deformity as well as muscle spasm trying to protect the area, and possibly a deformity depending on how severe the fracture is. For treatment, we want to treat it like we do any other fracture. We want to keep the arm still, keep the athlete calm, splint the area as we see it, apply ice to decrease the pain, and call 911 to have them transported. We need to, as we're waiting for 911 to arrive, we need to monitor the athlete to see if Volkmann's contracture does occur and or if shock does start to occur as well. For preventing fractures, we want to wear protective equipment and padding for activities that they're partaking in. We should have the athletes have adequate range of motion, flexibility, muscular strength at the forearm, as well as coordination and balance. So typical things as we looked at before, as well as calcium and vitamin D, sufficient amounts of those within the body. We can also have dislocations at the elbow. Dislocations at the elbow occur to the ulna. This is when the ulna is forced out of its alignment with the humerus, and most oftenly occurs in a posterior position relative to the joint. So the arm on that side may look a little shorter because it is pushed back posteriorly. This is again a medical emergency. There's a lot of arteries and veins and nerves in the area in a very small area, and this dislocation could sever them or stretch them. That could be permanent and life-threatening to the athlete. When we look at mechanism, these occur again For falling on outstretched arm, but this time we fall on outstretched arm with the elbow typically at a 90-degree angle. It can also occur with direct blow, causing that elbow to be forced posteriorly. Signs and symptoms: the athlete could go into shock, so we have to be cognizant of that. They're going to have pain, swelling, deformity, loss of function, sensation. So with that being said, we're going to make sure we treat them for shock if that does occur. Call 911 because it is a medical emergency. Help splint the arm as it lies and apply ice to decrease some of the pain. For prevention, try to avoid falling on outstretched arm, learn how to fall properly, and maintain good muscular strength around the elbow area. Sprains to the elbow occur to the ulnar collateral ligament and the radial-collateral ligament, depending on the side. So the radial-collateral ligament is on your thumb side. The ulnar collateral ligament is on your pinky side when we're looking at the hand. And these injuries occur from a fallen outstretched arm, fixed hand with twisting of the arm, or a direct blow to the elbow. When we're looking at the UCL, it's typically injured when there's a force applied to the elbow's lateral side, compressing that injury, and this type of force is what we call a valgus force, and it places a stretch and sprains the UCL. Likewise, the RCL, or the radial-collateral ligament, is injured by a force applied to the elbow's medial side, still compressing the area, and it creates that stretching sensation of the RCL. And this type of force is what we call a varus force. But these injuries can also occur due to repetitive sidearm throwing, mostly with UCL tears. Signs and symptoms include pain, redness, swelling, point tenderness, ecchymosis, increased tissue temperature, really all inflammatory signs and symptoms that we talked about before. For care, we want to make sure that the athlete stops activity and apply RICE, so rest, ice, compress the area, elevate the area if there's significant swelling, and refer the athlete to a physician if their sprain is severe, so grade 3 sprains. For prevention, wear protective padding and then make sure that we are aware of our surroundings and using proper throwing. If we are a sidearm thrower, we need to try to use overarm correct throw mechanics to decrease the stress that's placed on the UCL. For strains, strains are very similar across the elbow as well compared to other body parts. They can occur at the biceps brachii, triceps brachii, and anterior forearm muscles. Specifically at the forearm muscle strains, these are referred to as forearm splints. Think of this as if you know of shin splints at the tibia. These are typically what we see at the forearm as well, and this occurs with repetitive overuse of the muscles, and the muscles can also be stretched for an extended period of time, causing the fibers to tear. Other than that, we may get sometimes a one-time forceful muscle contraction or stretch that can also cause a muscle strain. Signs and symptoms for a strain at the elbow joint are very similar to those at the shoulder muscle strains. We have pain, loss of function, point tenderness, swollen red and warmth in the area, ecchymosis may appear, and then grade 3, if we have a grade 3 strain, we may see some sort of bulge or some sort of depression within the bicep area. Biceps are very commonly strained, and you can see there in the picture, this is what people sometimes refer to as the Popeye muscle, where the muscle is rolled up within that bicep area, and they would have to go in surgically to unroll that muscle and reattach it to the bone. For immediate care, we look at RICE for grade 1 and grade 2 strains. If it is a grade 3 strain, we may have to call 911 or refer immediately, depending on the severity of that muscle strain. Prevention, we want to make sure that we have good muscular strength and flexibility, and then we also want to make sure that not just the biceps and triceps are are strong, but all musculature around the elbow and forearm are strengthened regularly. An overuse injury that is typically seen in athletics as well as older populations is lateral and medial epicondylitis. When we look at chronic overuse injuries, this is a type of a muscular strain. It is an inflammation of the tendons that attach the epicondyles of the humerus at the bony prominences of the elbow. Medial epicondylitis is often referred to as golfer's elbow, while lateral epicondylitis is referred to as tennis elbow. When we look at mechanisms specifically, we're looking at the medial side. Medial epicondylitis is caused by repetitive forceful wrist flexion. That's why we see golfer's elbow, for that reflection of golfing. And then for the lateral epicondylitis, on the lateral side, we see repetitive forceful wrist extension, such as in tennis, where we have forceful wrist extension on a backhand. Both of these injuries most often do not occur from sport injuries, but rather from other daily repetitive physical activities such as computer work, construction work, or something like that. I've had a coach one time that he had lateral epicondylitis from carrying a baby carrier over and over and over again on the same side. So it does happen repetitively, not necessarily in athletics, but day-to-day life activities. Signs and symptoms include pain at the epicondyle, medial lateral side, depending where the injury is, muscular weakness, individual's grip strength is weakened, point tenderness at the epicondyle, as well as some swelling can be visible. Treatment, we want to make sure the athlete stops the causing activity and use the Rice principle. If signs and symptoms do not decrease, we can refer the athlete to a physician. And at the physician, they may prescribe NSAIDs to decrease the pain and inflammation. They may prescribe a brace or suggest a brace. These braces are typically referred to as counterforce brace that decreases the stress on the injured tendons as the muscles contract, and they also provide compression around the area. If all else fails, nothing else works, we can have a corticosteroid injection to promote healing and decrease pain to the injured tendons and the muscles. Prevention, most times, is use proper form and skills. Bursitis at the elbow can also occur. This is the last injury that we'll talk about within this section. But when we look at olecranon bursitis, the olecranon bursa sits on the olecranon, which is really the tip of the elbow between the bone and the skin. And olecranon bursitis is an inflammation of the bursa. Normally, we can't see the bursa because it's a small fluid-filled sac that helps with the fluidity of our movements. But it can be injured acutely and chronically. Acutely, it can be caused by a direct blow to the olecranon when the elbow is flexed. This could be of an implement, or typically when somebody falls on the elbow in a flexed position, or it could be caused by a chronic situation where there's constant rubbing of an object on the olecranon, such as an elbow pad or some sort of pad not fitting correctly. Signs and symptoms include pain, loss of range of motion, especially elbow flexion because of that swelling in the area. Acute bursitis specifically makes the elbow appear deformed because the swelling is very localized at the point of the elbow. Compared to chronic bursitis, swelling is a little bit more diffuse, but for both we can see ecchymosis, point tenderness, and warmth and redness in the area. For care, we want to apply ice, wrap the arm for compression with an elastic bandage or an elastic wrap, apply a sling for rest, and refer to a physician. For acute, we want to make sure that we use that Rice principle and refer the athlete to a physician to have x-rays completed to rule out fracture. For chronic, we want to make sure we remove the causative factor and use the Rice principle as well. We can also use over-the-counter NSAIDs to decrease that swelling of the bursa. Prevention, we need to make sure that if we are wearing elbow pads, we need to make sure that they're well fitted so that we don't have that chronic case of bursitis in the elbow area. The one injury that I did not talk about within this section is the ulnar nerve injury. This is what we refer to as the funny bone injury. So make sure you check that out in this part of the chapter.